The new iWALK 2.0 is a huge improvement over the original iWALK 3, especially when it comes to how easy it is to learn and use. I know what you're thinking, but you don't have to be an athlete or have any special skills. Practically anyone can quickly and safely learn to walk on the second generation, hands-free iWALK 2.0. I'm Kelly Roberts, and I'm so happy to be able to help you get back the freedom to being able to perform day-to-day activities without the pain and inconvenience of conventional crutches, thanks to the amazing iWALK 2.0. Before we get started, let's go over a couple of basic precautions. In previous videos, we learned how quick and easy it is to assemble the iWALK and showed you how to custom fit the iWALK to assure maximum comfort and safety. So if you've properly assembled and fitted your iWALK according to my prior instructions, we can proceed. Also, make sure you don't have any balance or strength impairments and that your uninjured leg is free of conditions that could impair your success. Things like an arthritic knee or a hip replacement. If you don't have an assistant, that's okay. Just make sure you have something sturdy to hold on to, like a railing, the back of a sofa, or something similar that you can hold on to in case you lose your balance. Okay, if you're ready, let's get started. You should already be strapped into your iWALK. Your feet should be side by side, about shoulder width apart. The first step is not a step at all. Instead, I want you to take a couple of minutes to just get the feel of standing and balancing on your iWALK. Your body is really smart, so let it start learning how to balance before you start iWALKing. Place your hands at your sides, arms straight, and bend at the waist, reaching down until your hand is at your knee. Do the same thing on the other side. Alternate back and forth several times. Next, put your hands on the front of your thighs and bend down with your arms straight until you touch your knees, and then come back up. Repeat these two exercises for a couple of minutes until you really get the hang of it. Trust me, during these simple exercises, your body is learning how to balance with your iWALK leg. Before you take your first steps, here's some helpful tips. Try really hard not to fight the crutch. The more you trust it and rely on it, the easier it is to walk on it. Stay loose, don't look down. You'll be really tempted. Keep your eyes forward, just like when you walk normally. Finally, feel confident. Our users constantly tell us that learning to iWALK is way easier than they expected. Okay, let's start iWALKing. Feet side by side, about shoulder width apart. Stand up straight, eyes forward, loose and relaxed. Intuitively, most people want to start with their crutch foot, but don't. Do this instead. Put your hand on the handle and push on it to tilt the iWALK forward. Keep tilting it and you'll naturally step forward with your good leg. Now follow it right up with your crutch leg. It's quite easy. Your body knows what to do. Keep going. Start with small steps, then gradually increase your stride. Keep walking in a straight line without turning around. When you're comfortable, let go of the handle so both hands swing naturally at your sides. The more loose and natural you walk, the quicker you'll learn. Pretty soon, you'll be iWALKing with comfort and confidence. If you're feeling fatigue in your good leg and your glutes, that's pretty normal when you're learning, and there's an easy way to fix that. Once you've got the basic hang of it, I want you to adjust the knee platform height up from the learning height, where it is now, to the optimal setting. Just extend the lower section until your hips are level when your good leg is straight. You can experiment with the height to find the one that best works for you. Also, if you wear shoes that are taller or shorter, you can and should adjust the platform height accordingly. After the first few steps of iWALKing, make sure your straps are still tight and adjust them if necessary. Keep practicing. You'll be amazed at how quickly you become an expert. Okay, so you've learned how easy it is to walk with the iWALK 2.0. Now I'm going to show you that getting up and down stairs is pretty easy too. But don't even think about attempting stairs until you're fully comfortable and proficient on the iWALK 2.0. It's not for beginners. I was on my iWALK for 15 minutes before I tried stairs. You might take longer. Just make sure you're good and ready before you attempt them. One great thing about the iWALK and stairs is that you have both hands free to hold onto the rails, which you must do always. To go upstairs, lead with your good leg, followed by your iWALK leg. Only go up one step at a time. Going down is the opposite. Lead with your iWALK leg and then follow with your good leg. Be careful that you don't catch your foot onto the step when descending. You might have to turn slightly sideways to clear. Congratulations! Now you've assembled, fit and learned to walk on your iWALK 2.0. You're ready to begin a highly functional, capable and independent rehabilitation. We wish you a speedy recovery and are honoured that you chose us to help you make it as comfortable, productive and pain-free as possible.